lecture, what we're going to do is define what immunity is very briefly. We will look at your barriers, which are truly the first line of defense. And then we're going to get into some organs. We're going to talk quite a bit about where the immune system plays out. Basically, we're going to give you a context. We're going to show you what the organs are, where they're located, and essentially how they function. Then we're going to get into the innate response. And so my question hasn't changed to you. What happens when you take that bacterium and you place it into your lung? How does your body respond to that? And that's the question that we're going to try and answer today. We're going to go through the nitty-gritties and see how this process happens. Once we cover that, then we're going to see how the adaptive response is linked in via the innate response. And look at the cell type that really is responsible for that. And it's really, really interesting from that perspective. And then near the end, we will look at what happens when the immune system goes wrong. We're going to look at some of the hypersensitivity reactions that essentially where your immune system overreacts. And that will end the lecture. Now this will probably be a very long lecture. So I will most likely be breaking this lecture into 2 parts. And that way we'll present one on Wednesday, and then the remainder will be on Friday, plus the start of the final lecture before the midterm exam. And don't forget, your midterm exam is coming up on July 24th, so make sure you're studying for this, okay? And we'll provide you with more details on the exam next week. And I'll probably get a lot of questions this coming Friday about it too. So you're free to ask me questions about that. So let's get into the immune system. Immunity defined. So what is it? It's literally a collection of mechanisms that defends the human body against disease. And one of the themes throughout this lecture, I'm going to try and emphasize the fact that your body has a lot of resources towards immunology. And you're going to see that throughout this lecture. It's truly amazing. It is one of the remarkable events that happens when you're within your body. It's one of the wonders of your body, especially the fundamentals of immunology. Look, just think about it. We have a number of organs dedicated to immunology. We have the spleen. We have lymph nodes. We have the thymus gland. We have the bone marrow, fetal liver, normal bone marrow. So there's so much geared towards immunology. A lot of resources are towards that. Look at the cells that are involved with that. Within the innate response, you have the neutrophils, which account for about 75% of your white blood cell population. The lymphocytes, they account for about 20 to 25% of your white blood cell population. Those are huge, huge numbers. Macrophages, which are derived from monocytes, you're looking about maybe about 4 to 8% of the white blood cell population. So there's a lot of energy, a lot of basically organs and everything, cells, tissues that are involved with immunology. And there's reasons for that, and we'll explore those reasons as we progress through the actual lecture itself. But let's look at the physical line first, physical barriers. So this is really part of your first line of defense. So when you're exposed to a bacterium, whether it's on your skin, within your body, you have these physical barriers to essentially try and keep these bacteria / viruses or whatever the etiological agent is at bay. And this includes things like intact skin and sloughing off the skin. Mucus. You produce quite a bit of mucus, and there's a variety of different cells within your body that produce mucus. Cilia action, especially within your respiratory epithelium. Your respiratory epithelium, especially your trachea and your main bronchi, are essentially lined by cells that have cilia surface attachments, and they basically motion back and forth, moving these particulates around. And these particulates do contain viruses and bacteria. Coughing and sneezing. So you're moving things around. You're getting rid of some of this virus, you're getting rid of the bacteria, etc., etc. But some always remains. It's just keeping the numbers low enough that it's not going to cause infection. So there is some sort of threshold with that. And we'll learn a bit more about that when we get to the next lecture. Tears, saliva, urine, all of these are these mechanical and physical barriers that you essentially are your first lines of defense. It's not only physical, but it's also chemical. So here we have a variety of different mechanisms that we've evolved to essentially deal with these microbes. Skin, for example, is acidic in terms of its pH, and a lot of bacteria do not like the acidic nature, so we keep these under control. Your hair follicles, they secrete a really waxy-like substance we call sebum, and that's pretty much antibacterial and antifungal from that perspective. Tears, saliva, nasal, perspiration, etc., they contain lysozyme, which, as we saw in the previous lecture, really does a good job on bacteria. Where does it function? Go back to that lecture if you need to. One of the bonds that it can actually cleave. You know which one's the glycosidic bond? Beta-1,4? Perfect. That's the one. Beta-1,4 glycosidic bonds. It cleaves those bonds and it helps keep the bacteria under control. In addition, the stomach, for example, secretes a very corrosive acid, hydrochloric acid, plus enzymes. And many of these can actually digest these pathogens. Literally, you're breaking them down. But there are cases where the bacteria may not break down. They can actually survive within this really acidic environment. And one of those is called Helicobacter pylori. And you know what that one, because we talked about that one last week. And we'll probably talk more about helico in the coming lecture too, next week. But once the barriers have been breached, guess what happens? You got it. We have another system that can essentially kick in, and that's the innate response. The innate response, and we'll get to that in a few minutes. Following that and linking in is the adaptive immune system. Now, in terms of timelines, we're dealing with the innate response comes immediate after that first line has been breached. So, for example, if bacteria gets into your lungs, and we couldn't get rid of it by sneezing and coughing, etc., and it does essentially colonize, then your body will respond to it. And we'll see how that plays out. We link in to the adaptive response. The problem is it takes time for the adaptive response to occur. And usually it'll be, on average, between 5 and 7 days, give or take. So it does take time for the adaptive response to take a foothold. And we'll see how that plays out later on. But before we get into this, we want to talk about the lymphoid organs and go through those in pretty much nitty-gritty detail. So what is this lymphoid system? Well, it is responsible for your body's defense. We want to, A, recognize self from non-self. We want self to be left alone and non-self to be dealt with, specifically what we call antigens. So these are the foreign invaders. We want to protect you from the viruses, protect you from bacteria, yet at the same time, leave yourself out of it. Because if you're basically mounting a defense against self, that's autoimmunity. And we'll cover that a little bit. That's a very complex category, by the way, and we'll cover just a little bit of that later on. So the idea here is to deal with antigens. Now, I'll be referring to all these invaders as antigens from basically here on. And it's handled by just a handful of cells, literally. We have B cells, T cells, and what we call antigen-presenting cells. You know, antigen presentation is really a process, and it's really not a cell itself, but historically and everything else, we call them antigen-presenting cells. And there's actually a few of them. We have what we call professional APCs and non-professional APCs. The professional APCs tend to be the macrophages, the dendritic cells, and B cells, versus the non-professional APCs, which tend to be the other cell types that are part of your white blood cell population. So we're talking about mast cells and neutrophils, etc., etc. And so I'll leave it to you if you want to figure out more about that, to Google that or go to PubMed and investigate that. It's actually quite interesting. But we're going to talk more about the professional APCs than anything else. And it's these cells here that essentially initiate and participate in the immune response. Now, I talked about how we have so much resources that are geared towards that immune system. And this is part of it right here. Not only the cells that we just talked about, which by definition are the parenchyma of the immune system, we have organs, literally organs that are dedicated to immune function. We call them the lymph node, thymus, and the spleen. In addition, we have a couple of other secondary organs that deals with immunology too, but their primary function is normally something else. And that's one of the big ones is the liver. And we'll talk briefly about the liver. And this year in HMB 202, as compared to last year too, we'll briefly talk about the lymph node and spleen, and we'll talk about the thymus in detail. Why? Because in the next course, HMB 302, goes really in depth about the lymph node and spleen, but we don't cover the thymus at all in that specific course. So we do all that here because it's more towards what we want with the story that we're talking about, how everything happens, rather than the functionality and the histology. This year we don't go too much in depth about the histology. I'll leave that for subsequent years. In terms of non-organs, we have something we call diffuse lymphoid tissue. That's an interesting name, and what exactly that is, and we'll get to that in a minute. And specifically, this diffuse lymphoid tissue, by definition, is an aggregation of lymphocytes. They're not encapsulated. In other words, they don't really form an organ on their own at all. An organ gives structure, and it's always going to be encapsulated by connective tissue, and we'll show you that in a little while. But when we're looking at this diffuse lymphoid tissue, it's really and literally aggregations of B and T cells together with macrophages and dendritic cells. But it's diffuse in terms of its form. It can be a variety of different areas found within your body. And depending on the region, we give them specific names. So for example, if your diffuse lymphoid tissue is associated with what we call the mucosa, and you know what the mucosa is, you know it as the mucous membranes. And mucosa actually consists of usually 3 parts. And it has, right next to the lumen, you have a specific type of cell. And below that cell, you will always have a connective tissue. And then the next layer beyond that, usually it's either going to be some sort of elastic layer or made of smooth muscle cells. And so those 3 components make up the mucosa. And we'll cover that in greater detail in 302. But for here, just know that it really and literally means mucous membranes. And so if it's associated with those, we give it a specific name. We call it MALT, mucosa-associated lymphoid tissue. So we have a lot of T cells and B cells that will be hovering around a specific area. And if it's associated with a specific region within the mucosa, for example, your gut, we call it GALT, which stands for gut-associated lymphatic tissue. And the perfect example is what we call Pear's patch, and that's located within your small intestine. In fact, it's within a specific region of your small intestine we call the ileum. In fact, the amount of diffuse lymphoid tissue found within the ileum allows us to use that as a key ID for that specific region. It makes life so easy when you want to identify where you are within the actual small intestine. And that's what we do with HMB 302. We essentially have a whole set of key IDs that we use that you can determine exactly where you're located within your body. And I'm not trying to sell 302. I just want to emphasize that this can be extended and you can learn more depth if you're interested in within 3rd year. In addition, BALT, which stands for bronchus-associated lymphatic tissue. It's similar to the Pear's patch, but it's found within the walls of the bronchus. And so we'll show you a little bit of that later on. In addition, you have an appendix, tonsils, and your anal region really contain large amounts of diffuse lymphoid tissue. Let me tell you a secret. Wherever you have an orifice or opening within your body, guess what? You're going to find some sort of diffuse lymphoid tissue. Why? Because these regions are being exposed. So think about it. When you're looking at the respiratory system or the digestive system, guess where the first starting point is? You got it, the oral cavity right here. When you're breathing in or eating food, you're taking in bacteria and viruses. Unless you live in an absolutely sterile world, which we don't, then you're going to take in some of those, what will potentially become antigens later on. One of the major events is within your tonsils. This is going to see all of that first, because they're right up in the oral cavity. Next region, if you're going to your guts and everything else, you have the HCl production that will take care of a lot of that. And essentially within your small intestine, you'll see that at the beginning of the small intestine, right on down through, we do have diffuse lymphoid tissue throughout, what we call the mucosal component, specifically within the connective tissue layer, which is the second layer. We call that the lamina propria. You'll find quite a bit there. And as you progress down the small intestine, you'll see more and more. And when you get to the ileum, where you see the Peyer's patch, you will have huge amounts of it. And we'll show you pictures of that as we progress through. And then you're changing from one system to essentially another system. So you're going from the small intestine to the large intestine. And what do you come across? The appendix. So this is at the beginning of the large intestine. And there you deal with any antigens that come down and through that tube. And again, at the end of that tube, the anal, just before you say hello to the outside world, you'll have a series of lymph nodules and diffuse lymphoid tissue within that region to deal with any antigens and bacteria and viruses, etc. So there's a huge amount of areas, essentially, that this diffuse lymphoid tissue occupies. And we'll see some images of that to give you more of a context as we go through. And don't forget about the organs. We're dealing with the lymph node, spleen, and especially the thymus. So your lymphoid system has two major types of organs, lymphatic organs: primary and secondary. So the primary, or some textbooks use central, the primary lymphoid organ is where these cells essentially develop. So they develop and mature of the lymphocytes themselves. In other words, we want to make them immunocompetent. And we'll see how that plays out specifically within the thymus. So this is for T cells, and then the fetal liver, pre and post natal bone marrow is essentially for the B cells. So we will deal with the thymus for the T cells, and I'll let you deal with this, but that won't be testable. Pretty much, they're both very interesting stories. And then we have what we call the secondary lymphatic organs. And this essentially provides the environment for these cells to work. So these lymphocytes need a place to essentially do their job. So it's their work area. And many of the times, this will be within connective tissue layer, especially within the diffuse lymphoid tissue. You'll see that within regions we call the lamina propria, for example, this is where we find connective tissue that supports that specific region. And it's their playground. This is where they do their functionality. And we'll see how that plays out in a little while. In addition, the secondary organs, we can name them. So we have the lymph node, spleen, we have this diffuse lymphoid tissue, and then we have the postnatal bone marrow, where this action could take place in too. I want to show you how complex and how your immune system is outlined, because the lymphatic system links a lot with the immune system. So here we have your typical lymph node, and we have your spleen up here. And we'll get a little more detail about what the lymph node is in a minute, and a little more detail about the spleen. But I do understand that you don't have a histology background, so we won't be going to great depth about that. But I want to show you the essentially vasculature that's associated with the lymphatic system. All these yellow that are in this picture here, vessels, are all part of the lymphatic system. And essentially, their major role is to essentially soup up all that excess tissue fluid. especially from an acute inflammatory reaction. As we'll see later on, AI, one of the major processes that happens within AI is what we call exudation reaction. So we have the leakage of fluid from the arterial side going through the postcapillary, going through the capillary bed, and then through the postcapillary venules. So all of those vessels become very leaky, and we'll see that later on, and especially during third year. And as fluid is essentially goes into these vessels and goes up this vessel tree, if you would, it will essentially go up into the venous side. You have two ports within basically the subclavian vein and the internal jugular. There's two little ports that the lymphatic system hooks into, and it delivers this lymph, if you would, back to the venous system for distribution throughout your body. So it's a very circular process from that perspective. And these systems are in fact separate circuits. And the circuits are connected within that region right here. Now, as the fluid travels along all these vessels, they will see what we call lymph nodes. And these are the tiny little organs, usually about a centimeter or two in size, and they do a couple of things. One of their major functions is to essentially deal with antigens. And not only that, but to filter out lymph of any particulates, any bacteria, any viruses, and if they find them, they will deal with those antigens. So that's a major, major function. So as you progress up, you're going to hit lymph node after lymph node after lymph node. And lymph nodes, they're found within specific regions too. So you find a lot within the axillary region, which is essentially, the groin region, which is essentially where your sex organs are found, and the axilla or under the armpit. This is where these lymph nodes would be found, plus you have quite a number of them in the neck too. And we'll show you a close-up image of that later on. And we'll see the functionality of these organs. The other one is the spleen. The spleen is a little bit more troublesome for students. It's completely disorganized, and that's the nature of the spleen itself. When we're looking at the lymph node, for example, it's an organized organ. It has structure to it, which makes it very easy to understand. The spleen, on the other hand, doesn't have that. It's more of a random type of organ, and it takes a little more effort to understand what's going on. But we'll explain a little bit this year in terms of how that functions. And the major function for the spleen, again, is to filter out blood and to deal with antigens. And we'll see how that happens very briefly. In terms of the diffuse lymphoid tissue, we have quite a bit of it found within your body. So this is showing you some parts of your small intestine. And if we look closely within these regions here, you'll see all these little finger-like projections. And just below these, within these little finger-like projections, you're going to find quite a bit of diffuse lymphoid tissue. And as you progress down the intestine, it builds even more. So by the time we get down into what we call the ileum, then you're going to see huge areas of, basically they call them aggregates of lymph nodules found within here too. Essentially, you have so much diffuse lymphoid tissue, it just fills within all these areas. So all of these dark nuclei that you see are in fact lymphocytes. And they can form actually a specific structure as well. If you see an aggregation of what we call mainly B cells within a given area, we call that, and it actually looks like it is a shape. It's very spherical in terms of its shape. We call that a lymph nodule. So found within this diffuse lymphoid tissue, we can see structure. And here is one right here. And this is, by definition, a lymph nodule. And all of this surrounding it is part of the diffuse lymphoid tissue. And you got another lymph nodule forming down here. It's really interesting. And we'll show you more pictures as we go. So this is a great one. This is showing you within the ileum. And we see these finger-like projections that are sticking out. And then found within them, all these dark staining cells are the lymphocytes. And you can see that on all this is by definition diffuse lymphoid tissue. And you can see we have structure forming right here. One here, another one here, another one here, and another one here. These are aggregations of mainly B cells. You'll see some dendritic cells in there as well. Plus, you might see the odd T cell too. That's perfectly fine. But by definition, these structures are in fact what we call lymph nodules. In fact, when you're looking at them, you can see a substructure within it. We call this a germinal center. And this, we can basically give it another name too. We call them secondary lymph nodules. And the ones that don't have this germinal center are called primary lymph nodules. What does the germinal center essentially mean? Well, it means that these lymph nodules have been stimulated by a specific antigen. So what happens is a B cell gets stimulated by an antigen. It becomes active. It travels to the nearest lymph node or diffuse lymphoid tissue, specifically a lymph nodule, goes into that lymph nodule and starts to do many things. Two of the primary functions is one, to make memory B cells, and two, to essentially differentiate into plasma cells. Because plasma cells is one of the main functions of the B cells. They differentiate into plasma cells, and plasma cells secrete antibodies. That's the primary function there. Perfect. So now we have a good solid foundation of what diffuse lymphoid tissue is. And we're showing you the playground, essentially where all of this takes place within your digestive system, respiratory system, anywhere this diffuse lymphoid tissue is found. Wow, look at this structure here. This is amazing. This is a tonsil. Look at the amount of diffuse lymphoid tissue that we're dealing with here. This entire structure is completely full of B cells and T cells within these regions. Plus, you're going to have macrophages and dendritic cells there too. Now, when we're dealing with tonsils, this is located within your oral cavity. And it is one of the first regions that will sample your food, quote unquote, as it progresses down. Saliva as it progresses down. So whatever's in there will be essentially dealt with in terms of antigens, if any antigens are present. Look at the number of lymph nodules that are present within this tonsil. Huge, huge numbers. So all of these purple that you see are lymphocytes, and then these structures, oval spherical structures that we're looking at, these are lymph nodules, and they're aggregations of B cells. And many of these are actually secondary. They contain a germinal center, so they've been stimulated already by an antigen. So let's deal with the lymph node first. As you can see, the lymph node contains varying amounts of diffuse lymphoid tissue and contains a number of lymph nodules. So found within lymph nodes, you have lymph nodules. So let's look at the structure. It's actually a very organized organ. You can basically break down this organ into three specific regions. We have the outer part of an organ, which we call the cortex, and we use that word for a number of different organs. So if we're dealing with the outer part of an organ, we label that the cortex. And you'll see that with the kidney, you'll see that with the thymus, that's coming up a little bit later. And the middle part right in here, is, well, there's a variety of different names that we give to that. I like to call it the paracortex region. Some textbooks will call it the deep cortex, and that's perfectly fine. But I think paracortex is an easier name for me to remember, basically. And then we have the third region, the inner part of the organ, and we call that medulla. And this is the medullary region right in here. And they contain, specifically within this region, a lot of sinusoids. And sinusoids are what we call vascular channels. You know them as capillaries, but they're a little different than the normal capillary you are used to. They essentially are a bit larger for that. And they have a very specialized function. And that's where essentially the action takes place within the lymph node. And that's where filtration also takes place. And then once you have, essentially, you're looking at the medullary region, and then you have the external parts of the organ. So we have what we call the efferent lymphatic vessel. This is where the lymph that's been filtered passes through. And we have what we call afferent lymphatic vessels. And these vessels essentially surround and are part of the external environment of the lymph node. And they're found around the entire organ itself, mainly on the convex surface of the lymph node. So what happens? Well, let me show you the two circuits. We have a lymphatic circuit and we have your blood vessels. So let's deal with the easier one too first. And that is the artery that comes in, goes in, circulates, and you're bringing in food, and you're bringing in nutrients, and you're taking away basically waste products. And then it exits out through the vein. Very simple procedure, very simple circuit. The lymphatic circuit is actually quite easy too, but it takes a little more explaining. Why? Because lymph comes in, and it follows a very linear pathway. You come in and you hit what we call the sinusoids. And so the sinusoids allow the lymph to travel down through the different regions, if you would, of the lymph node until you get to the medullary sinuses, excuse me, and then you exit through the efferent lymphatic vessels. So these vessels are afferent, they're the beginning, and this is the efferent lymphatic vessel. So the easiest way to understand the lymph node, and especially the spleen when we get to it in a minute, is to pretend that you're a lymphocyte, that you're coming in from here, and then you essentially follow the pathway of that cell as it progresses through the lymph node. So we're out here, we come in, and we are now in what we call the subcapsular sinus. We go down through the sinuses that are located within the cortex region, through the paracortex region, and then we get into the medullary sinuses. And as we progress through, then we go through the efferent lymphatic vessel and then out of the lymph node. Perfect. Now, what I didn't tell you, and what's important, is how filtration happens. So all these sinuses that are located in these regions contain macrophages. And these macrophages are essentially attached to what we call reticular cells, which are located within the actual sinusoids themselves. So we have reticular cells, macrophages attached to them, and stick out their pseudopodia out into the actual channel of the sinusoid. And anything that's there that shouldn't be there is going to be engulfed by the macrophages. If it's basically a microbe, virus, and or bacteria, that's going to be absorbed into the actual macrophage itself, and that's a tie-in to the adaptive response. Why? We'll see those details later on. So we're going to be dealing with antigens, and that's part of antigen presentation, fundamental immunology, and that we'll show you that later on. So all of these here are essentially dealing with antigens as it progresses down. All these sinusoids, they're lined by macrophages. And found within here, we have not only macrophages, but we have T cells, B cells. And found especially within the medullary region, we have plasma cells. So they make up the medullary cords, all these cell types. And the plasma cells, they secrete antibodies. And the antibodies go into the sinusoids and they travel essentially out of the efferent lymphatic vessel. And they go into general circulation eventually. So it's amazing how these little structures work. And in HMB-302, we go to much more detail in terms of how, and looking at the histology of what this all means. But I want to show you here where they're found. So we've seen how they're found within different regions of your body, but they seem to be within specific regions. And under the armpit, the groin area, sometimes within your legs, and especially the neck region too, where you find lymph nodules. So here they are here, here, all the way scattered down and through. So you see aggregations of them within certain specific regions. In histology, very, very interesting. Huge amounts of diffuse lymphoid tissue again, and that makes up the lymph nodule. So it's a very straightforward organ because it's structured. So here we have the lymph node. Now, what I'm going to talk about here is the functionality of the lymph node in the basic terms. In other words, I know you haven't had HMB-302 And in that course, we go really in depth about the lymph node. But here I'm just going to show you exactly what we mean by the filtration of lymph. So let's start with the outer part of this organ. As you can see here, this is what we call the capsular layer. And this is what this arrow is pointing to in terms of the overall structure of a lymph node. And as you can see inside, we have a lot of what we call diffuse lymphoid tissue. This is all these purple dots you see. These are all lymphocytes found within a lymph node. So we call this diffuse lymphoid tissue, and it contains, as you can see, a lot of lymph nodules. And many of these are actually secondary nodules. You can actually see the germinal center in many of these. And some of these are pretty solid. Here's a nice one that's solid. Now, as you can see, from the capsular layer, we have trabecula or septa that are coming into the lymph node proper. And what this does is adds rigidity and structure to the lymph node. And it really semi-compartmentalizes the lymph node in addition, as you can see here. It's going in and in and in. And surrounding the lymph node itself, we actually have what we call afferent lymphatic vessels that are coming into the lymph node. And before we get into the functionality there, I just want to draw your attention to the major areas. So the outer part of this organ here is called the cortex. And we call this the outer part of any organ, for that matter, except for the spleen. We'll get to the spleen later on. Now, in this situation, we have the outer part of the organ. And you can see the outer part really does contain most of the lymph nodules, as you can see. You get the odd ones that go in here, but most of the cortex will have the lymph nodules. And as we go down a bit into what we call the deep cortex, or what I like to call the paracortex region. And here we have more diffuse lymphoid tissue. And this region is mainly made up of T cells. The cortex region is mainly made up of B cells, but you will also find T cells there too, but the majority will be B cells, and you'll have dendritic cells, and you have macrophages in all these regions, going down and through. And the inner part of the organ, located here, is called the medullary region, or the medulla. And here, you're going to have a region, we call this the hilum region, or the hillux region, and this is where you have the entry points for the blood vessels, because you have to feed this specific organ, so you're going to have an artery coming in and a vein draining it, as well as what we call the efferent lymphatic vessel. And this is where the lymph, once it's filtered, goes out. So let's look how this functions. So around where we have these trabeculae, you can see these little white lines. And these are what we call sinusoids. And this is where the lymph travels. And so it's going to go from these lymphatic vessels, the afferent lymphatic vessels that are out here, coming into the lymph node and travel along within these sinusoids. And they're right next door to these trabecula that are found scattered throughout, these little septa that invaginate into the lymph organ proper. Now, as the lymph comes into the lymph node, it can't get back out. Okay? There's a one-way valve within that afferent lymphatic vessel. So as the lymph comes in, it's in, and as it percolates down through, it's going to see macrophages lining the sinusoids. And the macrophages are the ones that do the filtration. They're going to put their pseudopodia out into the sinusoids and take any particulates and any debris that's in there that needs to be phagocytosed and take it out of the lymph itself. And this happens along the entire journey of the lymph as it's going through. And any immunology that needs to be done will also be done within this area too. As you can see, there's a lot of diffuse lymphoid tissue. And that primary goal here is to deal with antigens. That's its purpose. So it's very easy to deal with. You're using a macrophage, which acts as an APC. And so when it takes antigens from the bloodstream out and engulfs them, it's going to basically say hi to the B cells and T cells that are within the area and say, hey, check out this. And it's going to attach it to an MHC2 molecule, and you're going to see that antigen being presented. And that's the adaptive response for that lecture that's coming out. Next, as the lymph travels down and through, it's going to get into the medullary sinuses, and it will eventually exit via the efferent lymphatic vessel. and then out and go to the next lymph node and continue up until it gets back into the venous system. The spleen. Ooh, very confusing. Why? Because it's very random. There's really no organized structure to it unless you look at it from a certain perspective. If you follow the blood flow of the spleen, it becomes very, very easy. So I can't really tell you that we have a specific organization. There is no cortex layer, unfortunately. So I have to essentially show you what specific regions are. So the outer part of the organ does have a capsular layer. Not a problem there. But if you look at the inner part of the spleen, you'll see that they're really a dark, dark, dark color, purpley blue, and a red color. All this region here. In fact, if you're looking at the organ proper and you cut the organ and you look at it without staining it or anything like that, this blue will actually look gray. And the red looks kind of darkish in terms of its color, rosyish red from that perspective. But when we stain it, we can really and clearly see it. So these dark areas that we see, here, 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 especially here, this is called white pulp. Why would you call it white pulp if it's dark like that? Well, it contains lymphocytes, white blood cells. That's why we name it white pulp. And the red that you see here is named because of that. It's very vascularized within this given area. It contains many, many sinusoids. And we call that the red pulp. Looks good. So we have these two major regions. It's hard to explain it using a diagram like this. So we're going to do the minimum, and we cover this in extreme detail in third year. So let's go to the next diagram. So it's a bit easier to explain it from here. And if you follow the vasculature, it will make your life so much easier. So from this capsular layer, we can break down the splenic vein and splenic artery. We'll talk about the splenic artery first, as it comes down the structure. So this structure here, this is the capsular layer, and this is what we call the trabecula. And again, we're semi-compartmentalizing this organ via connective tissue elements. But traveling down the trabecula is an artery, and we call that the trabecular artery. As it travels down, we get into what we call the white pulp area. So we'll continue down and through, continue on the way on our vessel here. And as we progress through, we're now in what we call the white pulp. This is where we see all these white blood cells. And then we go through, and you can actually see what this structure is. This is literally a lymph nodule. When we're looking at lymph nodules within the spleen, we give them another name. We call them splenic nodules, but they mean exactly the same thing. So within here, you see basically an arteriole going through the splenic nodule. And so it's going through all of this right here, by definition, is the white pulp. And once it gets to the edge of that white pulp, the next step is to get into the red pulp. So now we're into the red pulp and all the sinusoids that you see, all within these regions here. And then, as the blood continues, and remember you're pretending yourself you're an RBC, you get into the venous side and then out through the venous veins that are located here. And then eventually you'll be exiting via the splenic vein. Okay? But lining essentially the outer rim of the white pulp and most of the red pulp are sinusoids. And these sinusoids are lined again with macrophages. And all these macrophages are geared towards filtration of blood in this particular case. So we're dealing with blood. We're filtering out any bacteria, virus, and other antigens that are present within that region. Not only that, but you're looking and testing your RBCs to make sure they're okay. If they're too old, the macrophages will sense that and essentially destroy them. So there's multiple functions going on here. And so this is the basic anatomy and histology of the spleen. You can see the dark areas represent the white pulp, and the red areas here represent the red pulp. Good. And that's not a bad level of detail. The thymus. We're going to cover the thymus in great detail. Location. It's located in what we call the superior mediastinum, and it extends over the greater vessels of the heart. So essentially what that means is it's located in the middle, above your heart, and essentially this organ, and it's made of two lobes, and it gently placed over top of those greater vessels. This organ weighs about 40 grams, and like I said, two lobes, and you'll find that these lobes actually are made up of lobules. So tiny lobes found within the actual lobes themselves. We call those lobules, and we'll look at that in greater detail. It originates in early embryo. It continues to grow until you reach puberty and around there. And then it starts to, well, atrophy. And what happens is those lobes start to become infiltrated by adipocytes. So yours probably shows quite a bit of adipocytes within it, and mine will show even more adipocytes found within it too. And so this happens as a progressive deterioration, if you would, over your lifespan itself. During development of the embryo, essentially, T cells, we call them thymocytes, essentially migrate to the thymus, and this is where they become what we call immunologically competent. They get educated to deal with self versus non-self. And we'll go into a little bit of detail about how that happens. So here we are. This is where your heart's located down here. You've got the greater vessels that go back through here, and the thymus with their two lobes essentially are gently placed over top of that, and you have the rib cage protecting them. Very interesting. The histology image showing you a single lobe, and as you can see within this lobe we have very small tiny areas. So it's broken down into what we call these very tiny lobules, and we'll show you exactly what we mean by these lobules in a later image. But this is showing a child's thymus. So you can see it's very, very active in terms of its functionality. It's still at this stage. As you get older, you start to see this organ will atrophy, and it will become very infiltrated by all this whitish type of tissue we see here. And this is a type of connective tissue. This is what we call adipose tissue. And all of this tissue here is basically filler. You'll see some blood vessels, etc. within it too. But basically what we're doing is there's more adipose tissue and connective tissue than there is actual regions or tiny little lobules found within the organ proper. And once again, this is where it's located. And I just sort of remind you, in the context of your body, the other systems that deal with antigens are found as well. Small intestine, spleen, lymph nodules scattered all throughout the lymphatic vessels themselves. And then we have our thymus, which is where T cells migrate and we start their education. Interestingly, and pretty obvious, if you remove the thymus in early development of the child, it causes irreversible damage to your immune system. So you have a great deal of impaired function. And that's how important the thymus is in terms of your immune system itself. When we're looking at the thymus, we have two major components, and this accounts for most organs as well. We have what we call the parenchyma of the organ, which is essentially the cellular component of the organ itself. And we have what we call the stroma. And the stroma refers to the connective tissue or the supporting elements of that organ itself. This is an organ, so it's going to be encapsulated by connective tissue. So we have this thick layer of connective tissue that surrounds the entire organ itself, and it sends again what we call trabecula or septa into the organ proper. And it subdivides these into lobes. And we subdivide it into lobules, and that's the major focus here. So the lobes send in trabecula from the connective tissue outer layer, and it's subdividing them into little lobules. And It truly does a remarkable job at subdividing or compartmentalizing this organ. And we'll see why that happens in a little while. The organ itself, specifically the lobules themselves, can be broken down into two specific regions. The outer part is the cortex, and the inner part is the medulla. So when we're looking at the outer part versus the inner part, you'll see that there's a dense population of lymphocytes within the cortex region. And this stains very dark, so it's really actually very simple and easy to distinguish the cortex from the medulla region. And so when we're looking at these regions, look for the color change, and we'll show you that in an image that's coming in a minute. And this cortex region really shows you that it's mainly made up of T cells. In here, within the cortex region, there's extensive proliferation, and this is where these cells become immunocompetent. And we're going to talk about that with a diagram later on. In addition, we have other cell types. Not only do we have T cells, thymocytes that are beginning their journey, we have macrophages and what we call epithelial reticular cells, or easier just to explain as ERCs. We essentially have three types of these cells found within the cortex and three types found within the medullary region. ERCs, in some textbooks, you'll see them called thymic cortical epithelial cells. They mean exactly the same thing. Okay? I tend to use the ERCs because it's just easier to explain it in terms of the explanations that are coming up. ERC function includes a barrier formation. That's critical. Specifically, ERC1 forms a huge barrier. We'll show you that in a minute. They form occluding junctions with each other. So these cells line up next to each other all the way, and they line the vasculature. You have to basically feed the organ and take away the waste products, so you have an artery and vein that come in. You have to compartmentalize this organ, and we'll see that in a minute, and we'll see how that plays out. And so one way is to line all these vessels and line the walls of the cortex with ERCs. And these cells form a very protective barrier. And some ERCs also help with the education of the T cells, or the thymocytes. And we'll see how that plays out in a little while. So this is the first diagram I'm going to show you. It is an illustration